Hi everyone! Hi Sir Rafi. My name is Christine Maytalang and I'm from BSN2 of the College of Our Lady of Mount Carmel. And today I'll do a return demonstration and a proper way of doing a wound dressing or a wound care, especially in a community setting. So let's go ahead and start. So upon arriving at the patient's home, we make sure that we put our PHN bag on a table lined with a clean paper. So we make sure that, so let's go ahead and get the clean paper. We make sure that the clean part should be out, and of course the folded part should be the one touching the table. Okay, and of course this is for us to avoid contaminating our bag. So now, let's go ahead and of course put our bag in here. And then after that, we ask the family for a basin of water or a glass of drinking water if tap water is not available. So we're gonna be using the water for hand washing. And then after that, if once you already have the water, I already have it here, we go ahead and open our bag. And then of course get the soap and at the same time the towel, the clean towel. And then, let's go ahead and proceed with hand washing. So let's wash our hands with the soap. Make sure we clean it very well. And then, after that, we go ahead and of course clean our hands with the towel. And of course, after that, we go ahead and take out the apron and put it on the right side of the bag. So we'll be using this apron to protect our uniform later on as we do the nursing care treatment. And then after that, we go ahead and prepare all of the materials we'll be using for the nursing care treatment. Okay, this is to make sure that we have all the equipments accessible. Okay, accessible as we do the procedure. So right now we'll be doing wound care. So I'll be needing, of course, a gauze pad. I'll be using a medicine tray where I can put, of course, I'll be needing a bandage scissor, the povidone iodine, a cotton tip applicator, a micropore. I'll also be using cotton balls, 70% isopropyl alcohol, and of course our clean gloves, and at the same time of course the waste receptacle. Okay, so after that, after we have all the materials ready in front of us, we have to close our bag to avoid contamination and put it on one side or one corner of our working area. Let's put it here. Now, after we put our bag on one corner or one side of the working space, now let's go ahead and do or perform the procedure. Of course, the first thing we're going to do is to provide privacy for the patient. So in providing privacy, we can go ahead and close the door, close the window, or close the curtain. And this is for us to provide comfort for the patient as we do the procedure. Okay? And at the same time, we also explain the procedure to the patient. What is it that we're going to do and how is it going to help the patient? Of course, explaining the procedure will reduce anxiety on the part of the patient. Okay? And then after that, we go ahead and of course apply our apron to protect our uniform. And after we apply our apron, we go ahead and apply our gloves, our clean gloves. Okay. And now, after, of course, the reason why we're applying our clean gloves is for us to avoid infection, transfer of infection, cross-contamination, of course, from us, healthcare provider, to the patient, or even from the patient to the healthcare provider. Okay, so after we've applied our gloves, we go ahead and, of course, remove the dressing. So let's just pretend that this is the arm of the patient with the dressing. So, of course, what we're going to do is to remove the dressing. Okay, and then we, of course, put it or dispose it in a waste receptacle. And then after that, we remove our gloves as well. So in removing our gloves, we make sure that the outside part, the contaminated or the soiled part, should be put in inside. And then, of course, same goes with the other side of the gloves. And then we also dispose it properly, okay, in a waste receptacle. Okay, so of course, the reason why we're doing that is because any soiled materials with body fluid is considered, contaminated, and is subject for biohazard disposal, okay, in a correct manner, is depending on the agency's protocol. Now, it is a standard that right after an operation, the first dressing should be done by a surgeon. Okay, so basically, the first dressing should be done by a physician. Not within 24 to 48 hours, it shouldn't be changed. Not unless if needed. Okay, and again, if it needs to be changed within 24 to 48 hours post-operation, then it should be the healthcare, the primary healthcare provider who will do the change of dressing. Until that, the nurse can, reinforce the changing of dressing. Okay, now the frequency of dressing, okay, will depend on the need of the wound, and at the same time, it will, of course, be based on the doctor's order. Okay, so everything will also be put on the physician's order upon discharge. Now, of course, before we assess the wound, we go ahead and first apply a new set of gloves, okay, of clean gloves. So after we put on our clean gloves, the next thing we're gonna do is to, of course, assess the wound bed for any signs of healing. Okay, we assess for redness, foul odor, swelling. We also assess for any drainage, for any bleeding, or any skin breakdown. And then after that, we go ahead and cleanse, okay, the outside, or let's just say the surrounding area of the incision with a warm, clean, moist washcloth. Okay, so this is the washcloth with water, with warm water. We go ahead and cleanse it. Of course, we do it from cleanest to dirtiest. Then we go ahead and, of course, we dispose it. Okay, so the reason why we are cleansing it is because, dried blood or drainage surrounding the suture or the incision will be a venue for a microorganism to arbor, and at the same time, it can also be it can also serve as an irritant. Now, if the suture line, for example, requires cleansing, then it should be done gently. Okay, so we can either use a normal saline or a half-strength hydrogen peroxide, a betadine swab. Again, it really depends on the primary healthcare provider want regarding the antiseptic to be used. Okay, you can also use a cotton applicator. As we cleanse the suture line. Okay, so again, we don't just as much as possible, we do not disturb the suture line for it to heal faster. Okay, now in cleaning the suture line, we do it in rolling manner. And of course, we do it from the cleanest to the dirtiest part. So let's do it. And then again, you do not reapply. Okay? You do not reintroduce again. You do not reintroduce a used cotton tip, okay, into the suture line, okay? Because again, reintroducing a contaminated cotton tip will again introduce a microorganism to an already clean part, okay, or a suture line, okay? So of course, after that, we go ahead and remove our exam gloves because again, we consider this contaminated. And then of course, after that, we go ahead and do hand washing. Now, the reason why we're doing hand washing is to make sure that before we set up our supplies and, you know, dress, or should I say, wound dressing, we make sure that, of course, we have our hands cleaned very well. Okay, so in doing hand washing, again, this will also help us to avoid infection transfer. Okay. Hand washing. And then again, we wipe our hands with a clean towel. Now, after doing hand washing, we go ahead and set up our supplies, okay? Since we're done doing, of course, removing the dressing, we now have a very good idea of the things that we need, okay, for doing the dressing or for doing a wound dressing. But of course, before we do that, before we do dress the wound, we go ahead and of course apply a new set of clean gloves. And again, this is for us to protect ourselves from microorganisms. Okay, so after we apply on our clean gloves, we go ahead and grasp a 4x4 gauze pad. Okay, we grasp it just using the edge of it, and we go ahead and fold it in a 2x4 size and put it on the suture line in a lengthwise manner. So after that, we go ahead and tape it lightly using a micro pore or a bandage tape. Tape it lightly. Now, if the patient, you know, is having a sensitive skin, we can use a tubular mesh. And the reason why we are basically putting on, a gauze pad is for us to make sure, or for us to protect the wound from being touched by the patient's clothing. And at the same time, it can also collect, tissue drainage from the wound, okay, which can possibly harbor microorganisms later on. So we can also put on ABD, okay, which is normally applied on top of this, on top of the gauze pad as an additional protection for the wound. But again, that is that it's up to you, or it's up for availability of the supply. Okay, so after that, we go ahead and remove our gloves. We dispose it properly in a waste receptacle, and at the same time, we go ahead and do hand washing. So the reason why, of course, we are gonna do a hand washing is for us to make sure that we are not, we avoid infection, we avoid transmission of microorganisms to protect ourselves as well from any types of infection. So we go ahead and do hand washing again. And then after that, we go ahead and of course speak to the client or to the family. We go ahead and provide health teaching about the dressing, and you can. It is also very important for us to give them, dressing technique, okay, that they can use as of course they do the procedures, the procedure themselves. And then after that, we clean all of the materials that we've used before putting it back on the bag. Okay, so I'll be needing cotton balls. 70% isopropyl alcohol. Okay, I'll be first cleaning the bandage scissor. Micropore. This one as well. So after we have this ready, so we just get our waste receptacle, make sure to dispose it properly. After we dispose it, we go ahead and do hand washing. Okay, so we get the soap again, do hand washing. Wash your hands, and then we go ahead and dry it. And then after that, we go ahead and of course open our bag. Take our bag, open our bag, and put the materials, the clean materials, on their right places. Okay. And then, of course, after that, we take out or we remove our apron. We fold it away from us. We make sure that the soiled part should be folded inside and the clean part should be folded outside. Okay. And then put it inside our bag. And then same goes with the paper lining. We go ahead and make sure, by the way, in the paper lining, we go ahead and fold it and put it in our bag. And then after that, we make sure that of course we close our bag. So after we've done that procedure, we go ahead and take out the patient's record. We also speak to the mother. We write down all the data that we've gathered, we've observed, the nursing care and the treatment that we've done. And at the same time, we also go ahead and give instruction for patient care, especially if the nurse is not available. And then, of course, lastly, we go ahead and make an appointment for follow-up care. Okay, for follow-up care, it's either in the clinic or at home. And of course, making sure that we're very specific, or we highlight the date and time that the follow-up care will be performed. Okay, so basically that's it for the PHN bag technique, and I hope you've learned something today. Thank you so much, and I hope you all have a great day. Thank you. Bye.